Hi guys, welcome to iTTV. I am Mr. Wong, your English teacher. Today, the role of a doctor has become something important in our everyday life. I'm sure all of you have gone to a doctor at some point in time. But besides Western medicine, which is the normal doctor that we normally see when we go to a clinic or a hospital, there is also traditional medicine. Today, we are going to look at Chinese medicine, and we're going to be talking a little bit about acupuncture. So without wasting any time, let's find out what acupuncture is. Comprehension passage. Chinese medicine includes a vast array of folk medical practices based on mysticism. It holds the principle that the body's vital energy circulates through channels called meridians that have branches connected to bodily organs and functions. According to traditional Chinese medical theory, illness may occur when the energy flowing along one or more meridians is blocked or out of balance. The goal of acupuncture is to restore health and balance the energy flow. What is acupuncture and how does it work? In traditional acupuncture, needles are inserted at specific locations called acupoints in order to restore healthy energy flow to the body. Needles are put just deep enough into the skin to keep them from falling out and are usually left in place for a few minutes. The acupuncturist may twirl the needles or apply heat or a weak electrical current to enhance the effects of the therapy. Originally, there were believed to be 365 acupoints, corresponding to the days of the year, but the number identified during the past 2,000 years have increased gradually to about 2,000. Some practitioners place needles at or near the site of disease, while others select points on the basis of symptoms. In traditional acupuncture, a combination of points is usually used. Does acupuncture really cure illnesses? Most acupuncturists who hold the traditional Chinese view of health consider acupuncture herbal medicine and related practices to be valid approaches for the treating and curing of illnesses. Others reject the traditional approach and merely claim that acupuncture offers a simple way to achieve pain relief. 6 pulse aspects said to correlate with body organs or functions are checked on each wrist to determine which meridians are deficient in energy. The conditions claimed to respond to acupuncture include chronic pain, neck and back pain, migraine, headaches, acute injury-related pain, strains, muscle and ligament tears, gastrointestinal problems, indigestion, ulcers, constipation, cardiovascular conditions, high and low blood pressure, muscle and nerve conditions, paralysis, deafness, and behavioral problems, overeating, drug dependence, and smoking. Although scientific evidence may not be strong, acupuncture can prove to be useful by itself or when combined with mainstream therapies to treat the illnesses mentioned. Moreover, controlled clinical studies of electroacupuncture have suggested that it may help some people with pain after surgery and for those who have kidney stones. Acupuncture has become quite popular in the United States and Europe, where the technique is mainly used to control pain and relieve symptoms of disease, such as nausea caused by chemotherapy, but not to cure the disease itself. In 2010, there was said to be an estimated 18,000 licensed acupuncturists in the United States. More than 40 states have set up training standards for licensing or certification to practice acupuncture. There are also about 8,000 medical doctors in the United States who have been trained to practice acupuncture. Are there risks involved in using acupuncture? When done by a trained professional, acupuncture is generally considered safe. Relatively few complications have been reported, but there is a risk that a patient may be harmed if the acupuncturist is not well trained. Traditional needle acupuncture can cause dizziness, fainting, bruising, internal bleeding, convulsions, nerve damage, and increased pain. Traditional acupuncture also poses risks such as infection from contaminated needles or improper delivery of treatment. People who are taking anticoagulants, blood thinners, may have bleeding problems with traditional needle acupuncture. People with cardiac pacemakers, infusion pumps, or other electrical devices should avoid electroacupuncture. There is also the risk that an acupuncturist whose approach to diagnosis is not based on scientific concepts will fail to diagnose a dangerous condition. Likewise, relying on acupuncture alone and avoiding or delaying conventional medical care for cancer or serious illnesses may have serious health consequences. Whenever we talk about traditional medicine, it is very difficult to say that it doesn't work completely because it has been around for so long. And when we say so long, we mean thousands of years. But at the same time, any form of medicine that we consume or practice or take that does not include proper research can be dangerous. So it is always good to be careful and to make sure that when we do something, we do it knowing the advantages and the risks. Also, it is also not good to completely rely on just one method. It is always a good idea to look at all the alternatives. Now that we've gone through the passage and we've learned a little bit about traditional medicine and acupuncture, let's go through the text again and identify the words that we might find a little bit difficult. So let's take a look at our vocabulary list. Vocabulary list. We will be looking at 12 words today. Here are the first 5. The first word is array, and you can find this word in paragraph 1. Next, we have vital, also in paragraph 1, and goal in paragraph 1. Next, we have the words twirl and enhance, both found in paragraph 2. Now, what do these words mean? Let's start with array. Array means a large group of things. So when we say array, we mean a large group of things. Next, we have vital, which means very important. Goal, which means objective. Twirl, which means turn in a circle. And we have enhance, which means improve. Let's move on to the next 5 words. Here we have valid and achieve, both found in paragraph 4. Correlate and chronic, found in paragraph 5. And certification, found in paragraph 7. Let's see what they mean. Valid means based on truth. Achieve means succeed. Correlate means connect between 2 or more things. Chronic means of long duration. Certification means official recognition. And finally, we'll look at the last two words. The first word is convulsions from paragraph 8, and the last word is conventional in paragraph 9. Convulsions are sudden, uncontrolled movement of muscles, and conventional means traditional and ordinary. We've just looked at 12 words from the passage, and we've also looked at the meaning. But as you go through the passage, you might find many other words that you're not familiar with. All you have to do is highlight the word, take out your trusty dictionary and find the meaning. But remember, when you use a dictionary, don't just take the first meaning. Go through all the definitions and choose the best one based on the passage. You will be able to choose the best definition or meaning when you read the sample sentence. This will give you a better idea. Now that we've identified the words that we're not familiar with and we've found the meaning of these words, which means we now understand them, let's do a vocabulary exercise. Vocabulary exercise. Fill in the blanks with the correct word. Correlated, valid, enhance, goal, convulsions, twirl, certification, achieve, vital, and array. Number 1. To blank his language skills, he is attending a communication course. You may write your answer now. And the answer is enhance. To enhance his language skills, he is attending a communication course. Question 2. There is blank that the driver was dead on arrival. And the answer is certification. There is certification that the driver was dead on arrival. Question 3. It is blank that you use safety tools during this operation. And the answer is vital. It is vital that you use safety tools during this operation. Question 4. Blank, around, and show me your dress. And the answer is twirl. Twirl around and show me your dress. Question 5. Stress level is blank to heart disease. And the answer is correlated. Stress level is correlated to heart disease. Question 6. There is an blank of food on the table. And the answer is array. There is an array of food on the table. 7. The blank of the seminar is to acquire leadership skills. And the answer is goal. The goal of the seminar is to acquire leadership skills. 8. This is a blank document to prove what he has claimed. And the answer is valid. This is a valid document. to prove what he has claimed. 9. The old lady went into blank and was rushed to hospital. And the answer is convulsion. The old lady went into convulsions and was rushed to hospital. 10. The boys blank good results when they work hard. And the answer is achieve. The boys achieve good results when they work hard. Now that we've completed the exercise, review each sentence again, especially if you did not get all of them right. As you read the sentence, pay attention to the word and how it adds meaning to the sentence. This way, it will be easier for you to understand the meaning of each word. Let's move on to a comprehension exercise. Comprehension questions. Question 1. Why do people get sick according to traditional Chinese medical theory? You may find the answer in paragraph 1. And the answer is, when the energy flowing along one or more meridians is blocked or out of balance. Question 2. How is acupuncture done? You may find the answer in paragraph 2. And the answer is, needles are inserted at specific locations called acupoints, and sometimes heat or a weak electrical current is applied to enhance the effects. Question 3. From paragraph 4 and 5, find the words that mean A. Choose, B. Method. Let's take a look at the answers. The word choose means select, and the word method means approach. So the answers are select and approach. Question 4. Which evidence shows that acupuncture has become popular in the United States? The answer can be found in paragraph 7. Let's take a look at the answer. And the answer is, in the United States, there are currently an estimated 18,000 licensed acupuncturists and about 8,000 medical doctors in the United States who have been trained to practice acupuncture. Question 5. What main point is highlighted in paragraphs 8 and 9? And the answer is, the main point is that acupuncture can involve some risks. Whenever we do a comprehension question, it's always important to first read the passage. And whenever you come across certain parts that you're not familiar with, read that particular paragraph a few times. Normally, as you read it, it starts to make sense. Now, once you've completed the passage, then you attempt the questions. This way, once you read the questions, you will be able to find where the answer is in the passage much faster. So we've learned quite a bit about traditional medicine, especially when it comes to acupuncture. I hope you've enjoyed today's lesson, but that's all the time we have. Till I see you next time, always remember to continue reading. The more you read, the more you will learn. Bye-bye.